going to get started on our last keynote of the conference. And I'm glad that so many of you are still here, because this is really going to be, I think, one of the more important keynotes we've had all week. So we're going to take a look at legalization in North America. And representing the United States, we have Andrew Freedman, the co-founder of Freedman and Koski Incorporated. We also have here Krista Apse, the Director of External Relations for Cannabis Legalization and Regulation branch of Health Canada. And we also have Manuel Ruiz de Chavez, the President of the National Bioethics Commission of Mexico. Let's give them a hand.
Thank you so much, guys, for sticking with us throughout this entire conference. One more huge round of applause for AHP for putting this whole thing together. Linda Frazier is in the audience. If everybody could give her own round of applause. I'm going to be brief on, first of all, that was almost half of the dream come true, being told that I represent the United States. The other half is that I'm at the Olympics and not at the North American Cannabis Summit, but that's okay. But it is kind of the elephant in the room on this one, which is how does a guy who has a consulting firm of 3 people become representing the United States? And that's because there's a vacuum at the federal level on this, and I think it's something we should really be acknowledging, that I think there's an amazing thing happening with the laboratories of democracy right now and what we're seeing on the state level. But considering how much this could affect so many people and so many people's lives, the fact that there's no leadership on the federal level, just even any sort of vision about where we're going, is appalling. The opportunity that gives us is to, for once, not see ourselves as leaders in this area, but be here to listen. I'm under no assumptions that when this finally does hit the federal level that they will be great listeners, but one of the things that can start here on the public health level is realizing that the people that are going to lead the way this is done is the rest of the world. So I, for one, am excited not to hear about the United States vision of where we are going, but to hear the vision from these two. So I think for once, let's become listeners instead of telling everybody what the right way of doing things is. So thank you for having me.
Thanks, Andrew. So as Dan introduced, my name is Krista Apse. I work for the Cannabis Legalization and Regulation branch in Health Canada. You heard from my colleague Hanan this morning about data and surveillance. I think, Hanan, you're still out there. Who talked very eloquently about our objectives, or the government's objectives, in setting forth on this mission. And so I'll just take a minute to maybe set the stage for what is happening in Canada, because over the course of the last couple of days, I've heard a lot of different things about what people think is going on, and much of which is correct, but let's just start from a common point. One is that there's 2 main objectives that our political leaders talk about, and that's keeping cannabis out of the hands of youth and keeping organized crime and criminals from profiting from its sale. And every other objective rolls from those 2 main ones. There's a bunch of other things that we think about in terms of minimizing harms, in terms of making sure that we're measuring the impact, making sure that there are appropriate criminal sanctions and that sort of thing, but everything stems from those 2 main objectives. And so what I haven't said about that is that the taxation, the revenue component, wasn't what motivated the Canadian government in setting out to legalize, restrict, and regulate cannabis. Hanan also mentioned this morning that we've been at this for a little while. So there's been quite a bit of dialogue in Canada, and that was very deliberate. This is a transformational initiative. This is something that we as a society have to take seriously, that has implications for a number of different areas, as we can see from the audience and the variety of people here. And so that dialogue started in 2016 with a task force that provided the government with advice. And so that was a very deliberate public dialogue that set forth some of those public health objectives in minimizing the harms and risks of cannabis. When we say legalize cannabis in Canada, we also usually add legalize restrict and regulate access. So that's usually said together, and sometimes we even drop the legalize. We usually say regulate and restrict access. So the public health approach, what does that actually mean in Canada? I'll give you a little bit of a short overview as to what the law looks like. I'll talk a little bit about public education and what we have done there. I'll skim over the surveillance and monitoring, and Ann did a great job about that this morning. That's an important component as well. So in terms of the law, when I say restrict and regulate, it really does mean that cannabis is a little bit less illegal. And so there are already a number of prohibitions in place, and that continues. It just means that it's a little bit less, it's less illegal for some people. So adults who are over the age of 18 or 19 in some provinces are able to possess 30 grams of cannabis. They're able to legally purchase it, go into a store and purchase it. But that also means that there's a series of prohibitions in place. There's prohibitions on advertising and marketing, and it is true, I think it was on day one or day two where I heard somebody talk about the prohibitions that we have in place, and they are indeed significant. No health claims about cannabis. There can be nothing that's appealing to youth. We have considerable requirements for plain packaging, requirements for labeling to make sure that THC and CBD are included on the packaging, and health warning messages. So I think I've illustrated a few things. If you're interested in looking at more, there's much more on our website that does it in a succinct way. But you get the idea. Another thing that we started pretty early, and this was advice from people like Andrew, like our friends in Colorado and other friends in Colorado and Washington, who basically said to us, listen, there's a couple things that you need to do early before legalization hits. One is public education, because you're moving your population from an uninformed consumer to ideally, when the time comes, an informed consumer, should they so choose to be a consumer. And the second thing was around data and surveillance and having that baseline. So on public education awareness, I'll remind you, we started the dialogue in 2016. By early 2017, we were already out there with some key messages around cannabis. We had just introduced our piece of legislation. It hadn't yet passed, but we were nevertheless out there on drug-impaired driving, on health effects and health risks, and we've built from there. And we've done that a number of different ways, some of which has been really creative and awesome. Others have been more traditional. And like many of you have described, the challenge of making sure that we're actually reaching our audiences like youth. So I'm not a youth anymore, but we have to rely on people who can tell us how to do that. But in addition to that, our political masters also aren't youth, and so there's an expectation that they are receiving that information as well in the ways that make sense for them to receive it. So it was a pretty broad campaign that launched last year, and that will continue. As I said, Hanan talked about surveillance and monitoring, but that's another important aspect of our work. One final thing I will say that's an important piece of context before I close off is that we haven't done this alone. So this isn't only the federal government working here, it's together with our provinces and territories. So the federal government is responsible for overseeing production and cultivation, for overseeing to make sure that we've got national standards for products, and provinces and territories are responsible for setting up retail and distribution. So I know that I have a few colleagues here from the provinces and territories. We started work with them really early on. So again, I think it was early 2016. We've been meeting with them every 3 weeks since that time to coordinate, to share information, to make sure that we're all moving together on this. So it's been a fairly complex environment, but one where there's been a lot of collaboration. I think I'll leave it there.
Buenas tardes. I am happy to share the table with Krista and Edward. Andrew, thank you for your time. It's a pleasure. And I would like to thank the organizing committee, Neil, Linda, Lydia, and Sarah, for the wonderful job in the arrangement and realization of this international gathering to exchange views and ideas on current issues and common concerns across North America in regard to cannabis use. It is very important for the National Commission of Bioethics to be part of this gathering in light of the new scenario that is taking place in Mexico, which pose a series of opportunities and challenges that require our attention. I'm very grateful to the Secretary of Health, Jorge Alcocer, for his support to be here. As for the context of the social transformation concerning and occurring with regard to drug policy, we must first take in account the fact that over the last 2 decades, our country has suffered greatly the outcomes at the front of the war on drugs with no encouraging results to show for it. During this period, when faced with the new problem of the regulation of illegal drugs, a deontological framework was adopted by most countries in the world. That is an approach that placed greater emphasis on the aim of or the principle guiding an action rather than the outcome in itself. As a result, a global drug prohibition policy was implemented despite the fact that the production and consumption of illicit drugs, deaths, disease, crime, and official corruption increased constantly. The process of regulation and legalization in Mexico, we started with 2 groundbreaking developments in 2016. First, they granted to Grace Elizalde, who was diagnosed from an early age with Lennox-Gastaut syndrome, to import a drug containing CBD for her treatment, and on the other hand, and the protection granted by the Supreme Court to a civil organization, allowing cultivation, production, and recreational use for non-commercial purposes. This cannot be understood without considering the constitutional reform that was set out in 2011, establishing all the international treaties on human rights that have been adopted by the Mexican state as overriding policy. This reform has been key in framing the analysis of emerging issues and challenges in health, especially in the field of life and health sciences. It was along these lines that the first public consultation process to update the normative framework surrounding marijuana was carried out in 2016. As an outcome of this process, the federal legal framework was reformed in June 2017, establishing the legalization of cannabis for medical purposes, and provisional regulations were issued in October 2018 to set for the criteria for conducting health research with human subjects, as well as medicinal and industrial use of cannabis. In the same year, there was a ruling from Supreme Court stating that prohibition of cannabis use for recreational purposes is unconstitutional on the grounds that it undermines the general right of freedom of personality, a development that has paved the way for 5 persons to receive protection for recreational use of cannabis. In this prospective analysis, we must consider that there is a draft bill for the regulation and control of cannabis that is currently under review in Congress. Following the argumentation of the Supreme Court of Justice, this initiative was developed by the ruling party to set forth criteria for both therapeutic and recreational use of cannabis at the federal level, and that way the state with attributions to accompany the market with information, establishing minimum standards, monitoring, verification, and evaluation. There are adjustments to be made to the draft in order to guarantee harmonization with the federal and legal framework. However, this new regulation is expected to be approved by the second semester of this year. The landscape for the regulation of marijuana in Mexico in recent years has reached a turning point, setting bias aside and considering the latest scientific findings with regards to cannabis. We are currently working closely with health and human rights authorities to ensure that the new regulatory model set forth actions to prevent the consumption of drugs, especially marijuana, through campaigns aimed at children and young people, as well as implementing a comprehensive care model with a focus on harm reduction, establishing institutional strategies to mitigate the effects of abuse, which include minimizing access and availability among young people and other vulnerable populations, as well as analyze and reduce the burden of disease, tackle health risks in adolescents, and implement effective actions for the treatment of addictions. The national health system in our country aims to comply with the right to health protection, so one of its fundamental premises is to fulfill access to all therapeutic resources that derive from scientific development worldwide, among which are, of course, the pharmaceutical components derived from cannabis. However, the use of this medication requires in itself clinical research to support their effectiveness and safety. As for the social context of cannabis consumption, it cannot be overstated that Mexico could benefit greatly from cannabis regulation by removing an important source of revenue for criminal organizations, especially considering that our country is a major producer in regard to marijuana, heroin, and methamphetamine, which is distributed internally at retail and also trafficked internationally, along with cocaine produced in the Andes region. The effect of legalization on public health and human rights has a direct correlation with the implementation, since many aspects of regulation pose public health implications. When implementing the process of regulation, modifications and interventions must be introduced in a gradual way, while tempering and evaluating their impact. Policies must be evaluated with transparency on the basis of their results, both positive and negative. I would like to stress that this approach of transparency on the basis of the results, while considering the participation of well-informed citizens through debate or common deliberation in order to adjust or modulate existing policies that may be ineffective or subject to improvement. There are many effective measures that could contribute greatly in preventing an increase in consumption among the population, such as regulating the price of cannabis to avoid a drop in retail price, or limiting access to consumer cooperatives, as well as strengthening prevention through targeted campaigns. Considering that there is an important gap with regard to our knowledge about the consequences of using high-potency cannabis products, taxing cannabis concentration may represent a good measure to avoid health risks until further evidence is established. The main goal for regulating cannabis in Mexico should be to grant personal freedom while restricting access for children and young people, cutting off revenue for organized crime, as well as ensuring quality and safety in cannabis products. Historically, the reason why some drugs are deemed legal and others are not are completely unrelated to science or health, but to the social perception of the people who consume it. The motivation behind the first laws against marijuana, written in 1913 and 1914 in California and Utah, were actually set to regulate the entry of Mexican immigrants. The first regulation of opium, likewise, it is related with migratory flows from Asia to the United States, and with regard to cocaine, regulations discriminated against the African American population. In general, the proportion of people who have experimented with drugs has increased worldwide, and also most people quit consuming eventually. The number of users who develop dependency has risen in the last years. In this regard, I would like to remark that the social dimension is key in order to tackle addiction. What has proven most effective in order to overcome this burden consists of introducing adjustment to the social environment, as well as strengthening interpersonal relationships and ties with the community. Bioethics, as an interdisciplinary framework for analysis of emerging issues in health and human rights, offers a comprehensive approach to health, providing criteria to weigh the public health interventions, which include prevention with a focus on risk factors for vulnerable groups, timely detection, referral, treatment, and rehabilitation. The National Bioethics of Mexico has undertaken the task of fostering reflection on the social, economic, and health aspects of cannabis regulation, considering a scheme based on respect of human rights and synergy among nations. We celebrate the spirit of this meeting, which fosters an impassionate and interdisciplinary analysis of the outcomes of cannabis regulation from the perspective of Canada, Mexico, and the United States, which have different motivations, but also a common concern for the well-being of our people. Muchas gracias.
So a few questions we have prepared ahead of time that I think we thought would do the best of communicating to or starting a conversation that would ignite your thoughts. But we will quickly open it up. And I don't know, Dan, are you going to be walking around with the mic?
There we are. Sorry about that. So I think I'm going to pose a couple questions to the panel, then we'll open it up to everybody. One thing I wanted to ask is, since you folks have had a chance to attend the conference this week, and from where you sit on the world stage, what do you think we've learned here this week, and where do you think we need to direct our focus next as we all leave here and go back to our work?
Yeah, I can start. So I'm going to crack a little bit of a joke, and this is by no fault the organizers, but if you take a look at page, I think it's 17, I am the anonymous faceless person that's on page 17. So I'm going to talk about this from a bureaucrat's perspective. I'm part of the public service, so it'll be pretty politically neutral. So this is what I would encourage you all to think about. We have knocked on many doors looking for information, for best practices, for things that have worked in terms of public education, for things that have worked around regulations. Some of you, I think we've even talked about, things like mandatory pesticide training. There has been no shortage of graciousness, of time that you have all shared with us when we start looking for that information. And that will only continue. And I think the main point is that kind of collaboration needs to continue. And so the last 3 days have given me a bunch of new ideas on some of those topics, but there will be more. And I know sitting as a country, we regularly receive the same kinds of requests. And so it has been happening to us for years now on the cannabis for medical purposes side. But increasingly, we're starting to have quiet knocks on the door from other countries who are in Canada, who have sent delegations to Canada to understand better what we're looking at in terms of our regulation. And so I would encourage all of you to maintain that openness, maintain the willingness to answer questions from colleagues who are struggling with some of the same issues that you have done so a few years ago. I think it's fair to say that there are many pioneers in this room, and we can pat ourselves on the back, but that doesn't mean our work is done. We should continue to share and be generous with our time, be it regulators, be it members of the public health community, communications experts, researchers of any kind. This will only continue as this dialogue opens up even further.
I've been heartened, frankly, by the progress of the public health community since if you go back from the last NACS till today, what I'm seeing is everybody's actually putting their sweat equity into what's going on, and we are 3 levels deeper into the problems than we were 3 years ago, where the idea was, why aren't we getting together and sharing data? A lot of what I've seen this week is the result of what happens when you get together and you share data, and we are getting closer and closer to actually actionable regulation, suggestions for regulation, suggestions for programs that I think you are actually seeing in the law. So that's the part that really hardens me. The other part of this shift in vision, and this is speaking a little bit from the United States side, but I don't kind of know where else to do it, is, and I've been approached about this being part of the problem on this as well, is we are definitely letting equity be the tail on the dog on this, we consider equity, but we always consider equity last. Equity is always a theme that comes in kind of as an afterthought of what's going on. And I had a few people say some very intuitive and insightful things to me, but the biggest is we really should watch who's at the table throughout this entire thing, because if it's not the right people at the table, equity is always going to be the last part of the conversation. So that would be my challenge moving forward, that we have done a lot of what I mean is remarkable professional work where we are looking out for our communities. I'm not sure we've set the table exactly right. So that would be what I see.
I think that it's very important to build confidence in society. I think it's the first step that we have to do. And I think that to bring the stakeholders together and to discuss and to implement ways to know what's going on, because I think that is very important to bring bioethics in order to deliver, to discuss, to look at the problems from society or from research. And I think that the way to do it is my petition to follow up how is going on the Mexican regulation process. I think that this would be a good way to look at what will be to work for ahead for the next 18 months, for say, date. I think it is very important to bring together stakeholders from Canada, from USA, and to discuss what's going on in the Mexican process. I think that it will be very important, for example, to develop instruments, I don't know, perhaps a digital platform, in order to put there what's going on in Mexico, what is the new development, but to put it accessible to the people, to the researchers, to the policy makers. I think it is very important to promote the communication, the dialogue, and to work and to write down the experiences. Thank you.
Great, thanks. You guys actually preemptively answered my second question, so I'm just going to turn it over to the audience and let our great experts here quiz you a little bit before we run out of time. So if folks want to come down to the mic here, anything they've got to ask, let's do it.
While people are thinking about the second question, or their questions, I would add, because the other question was going to be, should this look like in 18 months? The only thing I would really suggest to this group is there is a lot of money on the sidelines that are now coming into this game, and 18 months from now is going to look radically different than it looks right now. If you were here on the first day, I said the dam has broke with the Farm Act, and I truly believe that to be true, and the phone calls I get on a daily basis are now different than the phone calls I was getting 2 months ago. So the one thing I would say is it can be really disheartening with that, and you're like, well, what are we ever going to do against $100 million corporations? I would caution against thinking about it that way, that ultimately politics is a very local game, that these people who pass laws, even at the federal level, have to come back and justify what they do to their own people. And so pay attention to the narratives as they're going through. Not just how you view the data that you're seeing, but how is everybody else viewing the data? And how can you nudge that conversation just a little bit in the right direction? How can you call Dan up before an article is written and say, here's something you might be missing in the data that really does paint a slightly different picture. And I will tell you, none of these actors, either media or politics, are nearly as evil as they're made out to be. They're not the best, but they're not nearly as evil. And they really do want to join in the vision of creating a better world. And so you are going to have to, in a lot of ways, be up against corporations. Sometimes you might have an idea that runs with the corporation, and I would urge you to think about ways to neutralize money against you. But I would just say, in the next 18 months, you do have to play, either if it's going to be at the local, state, or federal level, and that everybody wants to make everybody's life better. And so if you can give them the tools to make people's lives better, you'll probably get your way. So that would be the one thing.
Not evil and not the best. I'll take it. Why don't we go ahead and take some questions?
All right, cool. Brad Brown from UCLA Luskin School of Public Affairs and the Cannabis Research Initiative at UCLA. Thank you, the three of you, for your presentations. Really, really thoughtful. And the point that Andrew just opened the door to, which is assuming that within the next few years we do legalize cannabis at the federal level, we have international commerce between Mexico, Canada, and the United States through the lens of social equity and health equity. Who do you think will be the biggest losers? Who do you think will be the biggest winners? What excites you the most? What gives you the most dread about that prospect looking maybe 3, 4, 5 years ahead?
So I will say it echoes a little bit when we hear this way.
We're leaning in so that we can actually hear what's going on.
I believe, you just nod if this is correct, that the question is who are going to be the winners and losers on the international stage once international shipping is going on.
Right, and to your point, locally, let's look at Los Angeles, let's look at Vancouver, Toronto, let's look at Mexico City, Monterey, different cities. Who in those communities is going to end up ahead on the social equity lens and on the equity lens as far as equity licensing and some different things like that in, say, those cities versus who's going to end up not doing so well as we open up international trade in cannabis between the countries?
So maybe I'll start, and again, this might be the bureaucratic perspective speaking, but we have a long way to go before we open up import and export. And there's a reason why I say that, and I'm going to run off on a little bit of a tangent here, and I'll try and do it in about about 2-3 sentences or less. There are international drug conventions that require us to prohibit any kind of movement of cannabis except for medical or scientific purposes across borders. So even where we have legalized in Canada, I cannot get on the plane tomorrow and take my cannabis either. I can't export it out of this country, that's also legal, but I cannot also import it into Canada. So that will remain for a very long time, because what we're seeing already is a hesitation on many parts of the world to even accept that we have legalized, restricted, and regulated cannabis in Canada. And so that has to ease first before we can even start to talk about any kind of international trade with respect to cannabis.
So this is deep into economics on this, but one of the things I am concerned about to that point is ultimately cannabis is an agricultural commodity, and despite the fact that it's being sold at healthy profit margins right now, when we open it up, but assuming it goes forward, when we open it up to interstate commerce alone, you're going to see that price drop unless we have some controls there. But then when you look at international shipment, you're going to see another price drop. And those sort of microeconomic bubbles really can wreak havoc on politically engineered social equity programs. I'll give a minor example. In Colorado, in Denver, there was a lot of concern in one neighborhood called Larry Swansea that grows were majority owned by rich white guys, but also that they were being put in places where they mostly affected the Latino neighborhood. And this was an issue of pretty big proportion. So there's suddenly a lot of conversation about how to bring equity both in social programs and in economic development to Larry Swansea. While that conversation was happening, a rural city named Pueblo opened up their doors to having commercial grows, and everybody just moved out of Larry Swansea. And what was the problem there was suddenly a completely separate problem, which is there were empty warehouses that were tough to remediate for marijuana, and suddenly it was a completely different equity issue than before. And so if and when you decide to have these sorts of conversations, I really do urge when you talk to the community to really push to think about equity in 1,000 different ways, because you have to be flexible with it. What might be a great economic opportunity today is probably not going to be a good economic opportunity 2 years from now. And considering that nothing happens in less than 2 years in government, that means, by the time we actually get the wheels turning on a good program, it might be for something that's no longer economically viable. And so I think that means there's just a lot of other places you have to think about equity. Should there be general small business minority loans to anything that comes from the marijuana tax revenue, right? So that it's not just whether or not you can be the owner of a cannabis retail store, but that the community can decide where, what businesses should be open and when. And I just urge to push out the thinking to a little bit of a broader context, just because I do think this is going to be such a crazy ride with the economics of cannabis.
Well, I agree with this approach, and I think that it's very important to take in account that this is a long way. It's not an easy, but we have to provide confidence and to put things on the table and to discuss with society and to give the confidence that we are looking at the public health issues, that we are doing research, and everything orientated to protect society, to take care of the people. I think that's the most important thing, to say that the cannabis approach that we are trying to promote, is regulating, is going to take care of the needs of the society, the expectations. And I think that is not an easy way, but we have to show that the outcomes will show that the benefits are that these steps that we are taking and going through the benefit of people.
Hi, good afternoon. My name is Dave Chandrasekhar, and I'm a policy advocate based in DC, but working with a client here that's a low-income community health center that works with homeless population and other low-income folks here in West Hollywood. And so we're working on a project to study what are ways to improve access for low-income patients when it comes to medical cannabis. And so certainly prior to Prop 64, there were compassion programs and other programs that worked at micro levels, but it was not very formalized. And now, after Prop 64, there's a lot
Can you
of
slow down just a little bit? It's so hard to hear.
Looking at how to improve access for lower income patients when it comes to medical cannabis, and especially post Prop 64 here in California. But as I've been able to meet with many stakeholders here in the room and around the state, have found that not a lot of folks are talking about that aspect. The social equities there, which is of course a huge priority that is thankful as part of this movement here in California and hopefully in different states around the country. But curious if you have thoughts or recommendations, both of who to talk to, but also of what states can do, what are the provinces doing, what are the states doing, what is in Mexico and Canada as well, to address access for folks who don't have access to a lot of money. And so cost or other difficulties, disability issues, limited English proficiency, transportation, other things are posing, even once we get the industry up and running and functioning well. What about low-income folks who, on any healthcare service, have always had a problem, whether it's mental health, pharmaceuticals, primary care, etc. So just curious if you have thoughts from your three perspectives on that.
So it's access to cannabis for medical purposes.
For low-income communities.
For low-income communities. Okay.
Communities of color.
Yeah. Well, I can start. It's an ongoing, I'm going to say people are paying attention to that in Canada. Right now, we maintain, when we legalize restricted and regulated cannabis, we maintain the access to medical cannabis system that we had. Because we heard from patients that they had fought really hard. We had a series of Supreme Court decisions that made it a right to access cannabis for medical purposes, a legal right. And but what we have seen is that, and I think this is common to not only to Canada but elsewhere, is that there is no insurance coverage. So whether or not that's a provincial formulary, or whether or not for our Indigenous populations, or myself as a federal public servant, there is no insurance coverage, be it anyone who has a plan to access, or anyone else for that matter, seniors as well, or older Canadians as well. And so I think that won't change until sort of one thing happens first, and then that second thing. One thing that needs to happen is the research around the health claims. And so as we start to get more and more research, and as that confidence is built up in the medical side of things, there will be a push to make sure that there is some kind of insurance coverage for medical cannabis. And then that will spur more research and more innovation. I think right now what we've got is a little bit of cannabis for medical purposes in Canada is an entirely different paradigm than your regular pharmaceutical paradigm, and how you get to kind of aligning them in such a way that you see that insurance coverage, or you see access to cannabis for medical purposes is interesting. I will note, though, that our veterans in Canada do have access, coverage for cannabis for medical purposes.
That's great.
Well, I agree with, I think that we have to promote research and also to give public education in what can be done through delivering medicines, drugs, in order to treat some problems, health problems. But I think that is a very important process that has to deal in two fields: research and health education. And in Mexico we have different health systems. We don't have a unique as Canada has. But I think that we have to work in that direction to give confidence to society in order to provide health education and to show what could be treated by drugs from cannabis. I think it is very important to go in this step.
Recognizing that in the United States, access to medication or health as a poor person is next to impossible anyway, what to do with medical marijuana is going to be really difficult for a lot of reasons. A lot of them, Krista already touched upon, that actually exist here, right? That in order to make a health claim, you should go through a rigorous process and make sure that all the counterindications and all the side effects are there and can be monitored as somebody goes through them. There's at least one bill on the table in New York that provides insurance for medical marijuana. I think it's already dead, but I don't know. That's a possibility. Cannabis is just different because of this weird way it's made its way legal on one level and not legal on the other. It's just treated differently. Maybe there's a world with which insurance pays for medical cannabis. I think there's downsides to that where I do want this FDA research to happen, and I think that's really vital. So in my perfect world, all the FDA research is done, and where we found it to be very useful, there's insurance and there's accessibility for everybody. There's probably 15, even if we started that right now, there's probably 15 years between where we are right now and where that would be possible. And so what you do with that 15-year gap to both not take away incentives to do FDA research, but still provide access is, we're going to have to be really creative to come up with a solution if we do for that.
Great, let's give it up for our panel. All right, this is it.